lead really nicely into this conversation today. I'm going to touch on a lot of those same points, um, and really just going to focus in on kind of mental health in pediatric kidney disease and kidney transplant. And when I say pediatric throughout the talk, I think we could be talking about kids, adolescents, young adults, all of the above. Okay. Okay, so just some background on what I do as a pediatric psychologist here. So I work with multidisciplinary medical teams to address kind of whole person care using a biopsychosocial and cultural perspective. And, today we're going to talk about chronic kidney disease, kidney transplant, and in children and adolescents, and really how to identify coping strategies and interventions to support resilience, just like Katie was talking about. So I'm going to first discuss kind of some common emotional concerns that can come up among children with chronic illness and how different factors, individual, social, family, medical, academic factors can impact coping, resilience, and positive outcomes. So I want to kind of highlight this model of psychosocial components that are associated with resilience and positive health outcomes among pediatric patients with chronic illness. These are all factors that are important to consider. While we won't cover all of them in depth today due to time, these are all associated with positive physical and mental health outcomes. And so we think about patient mental health, quality of life, parent mental health, and family environment, and like family involvement, adherence, positive adherence to the medical treatment, a positive relationship with the multidisciplinary medical team, including a psychosocial team, which can include, social work, child life, spiritual care, creative arts therapists, psychology, and then supportive peer relationships, having cultural sensitivity and treatment planning, academic and neurocognitive supports, and then preparation for transition to adult healthcare. So some potential emotional concerns that children with chronic illness might face. I want to normalize these because they can come up for a lot of patients. And you may see a range of these. So we might observe like higher stress or distress. Sometimes, kids and teens might feel guilty about their illness or have like lower self-esteem, decreased quality of life, those feelings of feeling different from their peers. We can see anxiety, irritability, sadness, and sometimes we see sort of embarrassment. So not wanting others outside of the immediate family to kind of know about what's going on. So these are so important for us to identify so we can support kids with these. And we're going to discuss some different individual, social, family, educational, and sort of illness related factors to support positive coping. So individual factors. So a child's kind of baseline temperament and self-esteem, which, can be built over time, really helps with their coping. Having lower stress overall associated with the medical treatment plan and having like a higher motivation for the medical treatment, access to developmentally appropriate information about their health condition, and just overall resilience. These can all lead to really positive coping outcomes. And then, so social factors may impact coping as well. So, we know that having an illness can impact friendships and peer relationships. Sometimes the social functioning of the family in terms of like what activities families feel comfortable engaging in, having overnight sleepovers with friends or other limitations that sometimes come up. So research really shows that social support is still important, and finding ways to work that in really helps with adaptation and coping. So social support for the child and teen and also for the family. Family factors, so parental support and open communication in the family, especially related to talking about the medical illness, the treatment, those are positively associated with adaptation to illness and better treatment adherence, actually. Parent support has really been shown to buffer or reduce overall stress around this. And even, even children and teens with a chronic illness, they still need limits and expectations and discipline, right? And we know that they respond well to consistency within those limits. So while there may be certain educational factors that come up when someone has a chronic illness, like missing school more often, right? Potential for, learning challenges that can come up, we can certainly identify and prevent and intervene with appropriate neuropsychological evaluations and assessments, early intervention, any therapies like physical therapy, occupational therapy, speech therapies, and then implementing what's called a 504 plan or an IEP when necessary or when helpful to support positive outcomes in the educational domain as well. So some sort of medical and illness related factors that are associated with positive outcomes. So we know certain factors might confer risk. So a poor understanding of the illness and treatment, having conflict with the medical team, having a lower motivation for the treatment, a past history of adherence challenges. Some of those can be risk factors, but we can protect against those by encouraging and promoting these kind of protective factors. So again, I want to highlight the importance of the medical team and the hospital systems, utilizing kind of culturally sensitive care that considers diversity, equity, and inclusion factors, and like the importance of the team really understanding that patient and family and their cultural values and perspectives so that they can collaborate on the treatment plan together. Really providing developmentally appropriate understandings of the illness and treatment plan, assessing for comprehension over time, having that positive, trusting relationship with the medical team, having more motivation for treatment and kind of adherence. These are all ways to promote positive health outcomes, which we know impact overall quality of life and well-being. Okay, and then resilience, we know that that is also associated with more positive outcomes. So resilience refers to this sort of pattern of positive adaptation in the context of past or present adversity, such as having a chronic illness, right? It's a trait that we might be born with, or that we can also grow over time with experience and practice. And there are developmental assets that contribute to child resilience. So many of them are the factors we just talked about, but sort of external forces include positive experiences from people and organizations. So having support, empowerment, boundaries and expectations. Internal forces can include sort of internalized qualities that might shape one's like judgment and choices. So positive values, identity, commitment to learning, social competencies. And so the goal is kind of to build resilience across family members. So families should kind of strive for their own balance and figure out like what strategies and supports help their child or teen with, a chronic illness and their siblings to thrive and be resilient. And so while families might have times where they struggle and it's really hard to have a child with a transplant, they also may really develop this internal resilience and kind of closeness and cohesiveness and like creativity as a family. And often as a result of those experiences, adults and children really learn about their strengths, and also limitations, right? And can talk more openly, learn new ways to kind of solve problems, which really fosters mastery and pride. Okay, so let's talk some more in depth about specific skills to promote coping. So coping refers to self-regulatory processes that we use when we're faced with stress. And it can be thought about as kind of thoughts and behaviors that are mobilized to manage internal and external stressful situations. Um, it's used kind of to talk also about acts that regulate one's own behavior, emotions, thoughts, physiology, and the environment in response to those stressors. So it's important to note not all coping strategies fit for every situation. So we can use different ones in different situations, and they all have situation specific effects. So, a certain strategy might have one effect in one situation and the opposite effect in another situation. So there are different types of coping. Primary control coping is also known as active coping. So these are strategies that are directed at kind of actively changing a situation or one's emotional responses. So for example, problem solving, like I try to think about different ways to fix the problem or situation. Emotional expression. So I'm going to let my feelings out by writing in a journal or talking to someone. Emotion regulation. So I'm going to do something to calm myself down, for instance. Secondary control coping involves sort of adapting to the stressor through acceptance is one example. So kind of like saying, I realize I just have to live with things how they are. Distraction. So that might be saying, I think about positive things to take my mind off the problem. Cognitive restructuring. So I'm going to try to see the good that could come from the situation or what I could learn from it. And positive thinking. So telling yourself that everything's going to be okay. So unlike these engagement coping behaviors, which are focused on dealing with the stressful situation or one's emotions, disengagement coping, this final kind of type, refers to kind of efforts to distance oneself emotionally, cognitively, physically from the stressor. So this might include things like avoidance. So for instance, I try to stay away from things that remind me of the problem. Denial, I tell myself like, this isn't happening to me, kind of deny the problem, or wishful thinking. So I wish someone would just get me out of this problem or situation. And so some distinctions here. So avoidance is a really more of a passive coping tool that can kind of help us temporarily block out feelings like anxiety or fear, right? As a way to kind of avoid getting to the root of an issue, or even potentially discovering a solution. Whereas distraction is kind of can be thought of as more active, it's more time limited and more intentional. So kind of nuances among those different types. So problem solving is one that can be really useful. And these problem solving steps here can really enhance kind of your positive outlook and orientation and help apply like rational problem solving application tasks. So you just kind of start by identifying why a situation's a problem and generating solution alternatives, kind of creating a cost benefit analysis in your head to decide like which ideas you might want to implement and then implement that solution, monitor the effects of it and kind of evaluate the outcome. And problem solving can really minimize one's tendency to engage in more dysfunctional style coping or problem solving, like impulsively attempting to solve the problem or avoiding the problem. Okay, emotional expression. So identifying your feelings and learning to express them can be really helpful so that you can deal with them. So feeling identification and emotional expression is linked with well-being in the literature. This can be really helpful for kids and even adults, of course, too, who might struggle with identifying emotions. As you can see in this chart, there are so many nuances in terms of talking about emotions. So we kind of have these four main categories: anger, sadness, fear, and shame. And there are so many nuances and different shades within each of those. So we know that stress and anxiety create tension in the mind and body. And then when we're stressed, we have tense muscles. And when we're in that like fight or flight mode in our mind and body, we tend to tense up. And so relaxation exercises and mindfulness, exactly what Katie was talking about, these can really reduce tension in the mind and the body. Um, so I'll talk a little bit about these. So mindfulness, this is focusing really on the present. One classic mindfulness exercise that I'll talk about as an example is mindfully eating a raisin. So in this exercise, you're taking a raisin, you're really focusing on the experience in the present. So sitting quietly, you put the raisin in your hand, look at it visually like you've never seen one before. Notice the shape and texture, color, size, if it's hard or soft, smell it. Notice kind of your anticipation of eating it. Like, is your mouth watering? And if you don't like raisins, you can do this with anything, any food. You know, place it in your mouth, bite it, feel the texture, and chew and taste, and kind of describing all that as you do it. So, really just being so present. Whereas I think a lot of us, when we eat, we're like multitasking, right? And doing other things and thinking about what's on our to do list. Another kind of mindfulness exercise is just this five senses exercise, which can be done anytime, but especially when we're feeling stressed. So for this one, you focus on kind of the five senses. So what can you, right now in the moment, what can you see, hear, smell, touch, and even taste? Um, and so sometimes we need help to focus on what's happening right now rather than thinking about the future or those what ifs. Deep breathing, guided imagery, progressive muscle relaxation. These are all mindfulness-based stress reduction techniques. These are evidence-based. They're scientifically shown to reduce stress, anxiety, and depression symptoms. So diaphragmatic breathing is one, taking really slow, deep breaths through your nose for a few seconds, pretending you're breathing in the smell of your favorite food. Hold that breath for 2 to 3 seconds and then really slowly breathe out. Um, Muscle tension and relaxation exercises, also called progressive muscle relaxation. So these you kind of start at the top of your body. So tightening a muscle like your forehead for 3 seconds and then relaxing it and then moving on to your cheeks, your neck, your shoulders, your arms, move out through the whole body, kind of tensing and then relaxing those muscles. There are so many great apps that really help walk you through these techniques. So I've listed some here that I think overlap very much with the ones that Katie has on her resources. A lot of these are free and just really wonderful, even just for doing these exercises for a few minutes. You can also do simple mindfulness exercises like, taking a walk, getting some movement or exercise, other forms of relaxation and self-care, whatever that means to you. Watching a movie, cooking, cleaning. For some people, those things are healing and calming. For others, they might not be. Arts and crafts, any like soothing activity for you. And maybe that just means being quiet and having some alone time where you can be calm and do nothing to kind of refocus. I'm going to skip this now for the sake of time, but we can always send that. Was just a little clip about mindfulness that is another good example and illustration of this. Okay, so cognitive restructuring, I mentioned, this is a useful technique for understanding these maybe more down or anxious feelings and moods, and really challenging those sometimes wrong, like automatic thoughts or beliefs that can lie behind them. So you can use cognitive restructuring to reframe unnecessary negative thinking that we all experience from time to time. So these are in this table, that it's a list of thinking errors that we all like engage in sometimes, like false expectations, catastrophizing, all or nothing thinking, mind reading. These are some of these sort of automatic thoughts or thinking errors. An example here with this dog. So imagine a dog is running up to you in the street. You could have an automatic thought of, oh no, that dog's going to jump on me and bite me. And then you'd probably feel scared. Maybe you'd run away or act in a way that would show fear to the dog. And a different, more helpful thought could be, that dog looks so excited to pet and play, and then you likely wouldn't feel scared. You might, approach the dog very differently, right? So this is just a very simple way that the way we talk to ourselves and think can impact our behavior and mood and feelings. Okay, acceptance is kind of the key to ACT, or acceptance and commitment therapy, another treatment modality. The theoretical basis underlying ACT is essentially that pain and discomfort are a natural part of the human condition. And the more we kind of fight our thoughts and feelings, the more they chase us and control us. So, as a famous example of this goes, for the next 5 minutes, try not to think about this pink elephant. So hands up, who's thinking about the pink elephant now, right? This, yeah, like it's hard not to. This psychology study proved the same thing, that the more you try to suppress a thought, the more frequently you will think about it. So alternatively, acceptance encourages someone to be aware of kind of maladaptive coping strategies, which are known as experiential avoidance. So when we feel anxious or sad or angry, our first instinct is to turn away from those feelings, maybe to criticize ourselves, to maybe avoid by scrolling on social media or sleeping all day or eating a bunch of unhealthy food or getting upset and irritable with others, right? So this acceptance kind of orientation thinks about instead turning towards our uncomfortable thoughts and feelings and urges and accepting them exactly as they are without judgment and being gentle with ourselves. So kind of the goal is to increase psychological flexibility, kind of being in contact with the present moment, and kind of changing or persisting in our behavior in the service of whatever our values are. So another example, so imagine what you're doing with, distressing thoughts or feelings or memories. It's like fighting with a ball here in the pool in this picture. So you don't like these thoughts, you don't want them, you want them out of your life. So you try to push this ball underwater and out of your consciousness, but the ball keeps floating back to the surface. So you have to keep pushing it down or holding it under the water. And this struggling with the ball keeps it actually close to you. And it's really tiring. And in the end, futile, like it doesn't work, right? So if you were to let go of the ball, it would pop up, it would float on the surface near you, and you probably wouldn't like that. But if you let it float there for a little while, with your hands off of it, it would eventually drift away and out of your life. And even if it didn't, at least you'd be able to enjoy your swimming in the pool, rather than spending your time fighting with this ball. So again, similar to what we were talking about, in terms of tools from positive psychology. So positive psychology refers to these positive psychological resources that we can work to increase. So kind of positive affect, um, your outlook and attitude and optimism. And these can really be increased and built like a muscle. Gratitude practices are a really helpful way to build these, and they do have scientific evidence as well. So one example is this 3 Good Things app. Every day for 7 days, you write down or record 3 good things that happened that day and your role in bringing them about. And this has shown to increase happiness and decrease depression symptoms even after that first week of completing the exercise. Random acts of kindness. This actually promotes well-being in the person doing the act of kindness even more than the receiver. So giving back to your community of being a helper, clarifying your values, so kind of defining core values and embracing them. And the best is when these values overlap across different domains like school or work or relationships or leisure. This is really protective. And again, we know resilience can grow stronger over time. It's like a muscle. So health behavior strategies can really support overall well-being and mental health. So we know regular sleep routines impact our mood and well-being, being consistent with our bedtime and wake time as much as we can. And for teens, you know, even though they might have that biological clock that shifts a little later, we still want to make sure they're getting those like 9 to 11 hours of sleep. Making sure bedrooms are quiet and dark and relaxing, not having electronics in bed at night. And tough one these days, but can be really helpful. Um, Avoiding large meals and caffeine before bed, getting some movement and being physically active during the day. This can really help you kind of fall asleep more easily at night. Cortisol, one of the stress hormones, is released during movement and exercise, and this can actually reduce cortisol after exercise. And then good nutrition and healthy diet, fueling the body is important as well. So positive adherence to a medical regimen, really, we know that supports overall well-being, and there's that bidirectional relationship between physical and mental health, right? So some specific adherence strategies that can really support coping and support adherence. So we know education about the illness and information help, assessing comprehension of that as well. But then behavioral strategies are really important. So having a routine is really helpful for setting up habits for any behaviors. So like keeping medications in the same place in the house, or having a system where parents might check in with their teens about taking the medication. Simplifying the regimen as much as possible. Medical providers can help with this. Having tracking systems that like calendars and written reminders around the home, reward systems, even for teens, these can be really helpful and useful and motivating. Chaining or kind of combining medication taking with routine cues. So like I brush my teeth and I take my medications. Those can be really helpful. I know we all have our cell phone alarms, and that's something we can rely on as long as we don't like turn it off when it goes off. There's so many helpful apps these days, many aimed at kids and teens. So there's like Plant Nanny for water intake tracking. Transplant U is a child and adolescent friendly one for transplant. There's many medication tracker and reminder apps as well. Pill boxes really help with that like portability aspect, taking them out of the home and just organizing medications. We know that actually the strategy of like just watching the clock is negatively related to adherence. So we want to use a lot of these different other helpful strategies. And then additional factors related to adherence. So we know increasing social support is really helpful for these strategies. So This might include having, people at school who support taking medications like a school nurse. We have some, teens who are open about their transplant and medications with close friends and say their friends are worried about them and help remind them when they're together. Um, Parents are a huge and caregivers are a huge piece of this. We know that family difficulties or conflict or parents who are having their own mental health struggles can impact adherence. But we also know that families who have a greater number of strategies to support adherence, that supports more positive adherence. So verbal prompts, verification that a medication was taken, using those pill boxes. A lot of teens prefer that like parents just check the pill box to make sure the teen took the medication rather than asking them, because sometimes it can feel like nagging, right? So just being creative and figuring out what works in your house and family. Okay. I want to also quickly review some of these professional resources for mental health support that Katie also talked about. You can really access psychosocial resources that are available at your hospital or clinic. You can call your insurance or look online for a list of local providers. And then the American Psychological Association and Psychology Today also have great therapist locators. And then again, know that there are, crisis lines and organizations that can help. The National Crisis Line is a great one, 988. There are state-specific crisis services, both that you can call or text and go to in person. And I've listed some additional resources here in those moments, if those moments of crisis come up. But we always just feel like these are good things for any patient and family to have, whether it's for themselves or a loved one. Okay, these are my references. And thank you all so much for having me today and being so